Hello, and thank you for joining me today to discuss a risk awareness campaign to reduce the growth rate of STDs among elderly adults. On the 17th of this month, a press release from the CDC reported that cases of 3 nationally notifiable STDs, chlamydia, gonorrhea, and syphilis, have increased for the first time since 2006. The CDC reported 1.4 million cases of chlamydia, 350,062 cases of gonorrhea, and 19,999 cases of syphilis. Overall, 20 million new cases of STDs are diagnosed each year. But don't assume that rowdy teens and college students are solely to blame. Young people between the ages of 15 and 24 are only estimated to be involved in half of these diagnoses. So who else is at risk? Reports ranging from 2005 to 2013 point the finger at adults aged 55 and over. The CDC estimates that adults 65 and over have seen the cases of chlamydia increase by 32% and cases of syphilis increase by 52%. Additionally, of all new cases of HIV reported in the US in 2010, 2,500 were newly diagnosed adults over 55. But because adults 65 and older only make up about 16% of the US population, and the thought of them being physically intimate is still highly stigmatized, most organizations like the CDC focus their campaign efforts on larger high-risk groups like homosexual men. What these organizations forget, though, is that STDs can often have more adverse effects in elderly adults than on any other special interest group, and can sometimes lead to death due to the aging immune systems. Some organizations, like the Centers for Medicare and Medicaid, have made large strides in providing preventative measures by offering coverage for STD preventative services without cost sharing. But even still, senior citizens are the least likely to undergo STD testing. Why? Because elderly adults are often not given a reason to use them. Doctors and nurses often skip over questions of sexual activity during medical checkups, for various reasons, including embarrassment and simple oversight, assuming older adults are no longer sexually active. Likewise, older adults often feel the same embarrassment at bringing up the topic, practicing their own don't ask, don't tell policy. The prevention and control of STDs becomes trickier in elderly communities, where adults over the age of 55 socialize in large numbers. An analysis of data from the CDC completed by the Orlando Sun-Sentinel reported that syphilis and chlamydia had increased nationally by 43% between 2005 and 2009. In comparison, retirement communities in Maricopa and Pima, Arizona reported cases of these STDs were up 87%. The villages in Central Florida had similar results, seeing growth rates of 71%. To help stop the trend of rising cases of STDs among seniors in the United States, the following campaign proposes targeting high-risk seniors in 55 and over communities across Arizona and Florida, where the growth rates for STDs is highest. The objective of this campaign is to raise awareness of the risks of contracting STDs during the golden years. A grassroots approach is proposed, targeting adults aged 55 and over in retirement communities across Arizona and Florida. This campaign will leverage local physicians and prospective buyer tours to offer STD testing, private safe sex education classes, and educational material. The primary audience for this campaign is adults 55 and over who are currently living in retirement communities in Arizona and Florida. The goal is to change this group's sexual behavior. Census and demographic information from these communities profiles this group as educated, retired, non-religious, white, non-Hispanic Republicans with an estimated household income of $59,000 per year. Messages broadcasted to this audience will revolve around the importance of STD screenings and protection before partaking in sexual intercourse with a new partner. Additionally, this campaign feels it necessary to target groups, individuals, and organizations that provide access to and influence over older adults in these communities. This group is our secondary audience and consists of doctors, nurses, pharmacists, community managers, event planners, and homeowners associations, among others. They will receive messages emphasizing the need to provide safe sex information to seniors by speaking out against the stigma of sex and seniors. This campaign uses a two-level messaging strategy. Sex doesn't stop at 70, and neither does the spread of STDs. Get tested. This message introduces the primary and secondary audiences to the campaign and looks to break the stigma of senior sex. By reminding both audiences that seniors are sexually active, doctors may provide more thorough checkups of elderly patients, and in turn, elderly patients may be more willing to offer this information. The growing rate of STDs among seniors in the United States, 43%. In the villages, 71%. Use a condom. This message can be customized to the specific name and statistic of the community the collateral is being distributed in. The purpose of this message is to shine a light on the level of gravity of STDs in retirement communities, where retired adults often live carefree lifestyles. Adults over the age of 55 and physicians alike often consider STDs to be a youth-specific concern. By emphasizing the growing risk among retired adults, seniors may be more inclined to get tested, use protection, and talk to their doctors about potential risk factors. This campaign is designed as a grassroots effort, focusing on face-to-face and print communications for message dissemination across both the primary and secondary audiences. Face-to-face communications for the primary audience will include consultations with medical professionals, as well as group sessions and sexual education classes offered through local community centers. Primary audience members who are in the early stages of buying into a retirement community will also be given a guided tour of the community's amenities, including local medical practices that can provide more information on sexual health. This method has been chosen as a primary medium because some research has shown that this age group is more receptive to and prefers face-to-face communication when learning about important matters, even when literacy is not an issue. Print communications, including handouts, pamphlets, fact sheets, and posters, will be used as supplements to medical discussions. The material will provide in-depth information on STDs and will be distributed during clinic visits at pharmacies and at local community centers. The secondary audience will receive face-to-face messaging at medical conventions and workshops that will offer lectures on the medical advances in sexual health for the elderly. They will also receive at least 4 on-site visits per calendar year from an assigned health communications specialist to discuss pain points and possible tips for easing personal discussions with seniors. The success of this campaign will be measured over a 5-year period using data collected by the CDC's yearly STD surveillance report card, as well as annual surveys among healthcare professionals. The data will be analyzed each year to determine the impact the campaign has had on the growth rate of STDs in retirement communities. After a 5-year period, the campaign will be re-evaluated to determine the impact made by the program, areas of weakness, and whether additional steps need to be taken to further reduce the STD growth rate. The rise in STDs in the United States has become an epidemic, and it is imperative to public health that we make every effort to stop these infections from spreading. This requires that the CDC expand their campaigns to include adults aged 55 and over. The key to this campaign is its strategic inclusion of a secondary audience. Including this audience provides the campaign with an additional ally to help reach older adults and influence their behavior. Change can happen. Everyone just has to be open to addressing the elephant in the room. Thanks for watching.